Hi, I'm Dr. Thurai, the orthopedic spine surgeon from Gleneagles, Kuala Lumpur. Osteoporosis is a condition where the bone density, the bone has a texture. So the texture is how strong the bone is. So the density of the bone is affected as we grow old. From a very strong bone, it eventually becomes a brittle bone. So that's what osteoporosis is. We are talking about the density of the bone. So this is an aging process. Of course, does the young people have osteoporosis? Yes, they do. But this is only a selective group of them, especially people who are taking long-term steroids, grouped in certain diseases like asthma, certain connective diseases like SLE, some kidney patients which is on steroid do develop osteoporosis. These diseases are more affecting the elderly group. As we know, women intend to live longer than men. It's natural. Okay, men can be a bit naughty, okay, a bit crazy, and they intend to have much more shorter life compared to women. But women who live longer, especially after their menopause, their bone intend to become much brittle, and they have a tendency to have fractures. This is what we are worried of. As you age, when the bone becomes more brittle, especially when we are talking about spine, you see the elderly women get shorter and shorter. They start to hunch. Their gaze, when they look far, they intend to see much lower compared to their normal height. So this is how the natural way, the progressive of the disease. When this happens, the ladies intend to have joint pains, bone pains. This is what they complain of, especially the elderly women. The best way to know whether you have osteoporosis, you have to look for help. You have to ask your doctors. When you see a doctors, the doctors will ask you some history, means some questions, things that happens to you, how active you are, the type of diet you are taking, do you have any diseases that affects your bone. Then they will do some tests. Which are the tests they can do? They look at your vitamin level in your blood, especially vitamin D. They also will do some imaging. The most basic imaging they can do to know whether you have osteoporosis will be an X-ray. X-ray tells a lot of things, like how picture tells a lot of stories. So by doing a simple basic X-ray, you can roughly diagnose someone with osteoporosis. But the best way to do osteoporosis diagnosis is to do a bone density scan. Most hospital has, and we have the same system here. So by doing a bone density scan, we can tell you whether you are having a normal bone density, a moderate bone density, or osteoporosis bone density. By knowing this, we can literally tell you whether you can break your bone easily. And we can advise you the things that you can do to prevent this or to treat this. If you have osteoporosis and if you are at risk of falling down and you intend to have especially wrist fracture, you can have hip fracture and much more concerning spine fracture. So by looking at the bone density scan, we can advise you the type of osteoporosis you have. Either you have mild, moderate or severe osteoporosis. Then we can find a way to treat you or to advise you or to give you things that tells you do's and don'ts that you can help you to improve your bone quality. Remember, osteoporosis is a lifestyle disease. Aging is a process. You can't reverse it. So what you need to do to prevent or to delay complication for osteoporosis is to improve your lifestyle. you need to be active. By doing exercise, especially strength training exercise, it will help to improve the density of the bone. If you are running, if you are cycling, or even swimming, it's called cardio. It's a cardio exercise. It helps your heart and your lung, but it doesn't help your bone. If you want to help your bone, please do strength training exercise. I'm not asking you to lift weightlifting. Simple dumbbell workout, simple body strength exercise will definitely improve the quality of the bone. Of course, you need to get your doctor's advice. Make sure you have your good heart condition and your lung condition before you do that. And if you have some joint problems, please prevent from doing strength training without any advice. Osteoporosis is treatable. It also preventable, provided at what point you seek for treatment. Come early, we can help you to prevent osteoporosis fracture. But if you are late, you might end up having complications from that. Then the recovery process is very, very long. Thank you.